So we discussed with our partners to come up with a plan B. What can we do without going against the government guidelines in each country as far as COVID-19 is concerned? So we developed a plan B strategy. And this plan B strategy was for us as a charity to help to keep the project team together without losing any project team, but again to advise them to work from home. So during this time, none of them were coming to the office. So they were working from home, but we at that time we discussed with them how can we support them to ensure they have a good communication. So when I say good communication, they got an access to internet from their home, and each one has to have an access to a laptop or computer or a smartphone. So we could keep on communicating during that time. In each project, we have structures in the project which we have developed from sometimes, which are called volunteers. I remember some of you visited in Malawi, you saw them, the volunteers like from the preschool, they are volunteers at the kids clubs, there are volunteers for the child rights projects we are working. There are volunteers, we call them facilitators in our VIP program. So those are our main contact structures in the project's location on the project's level. So we advise our partners to ensure they keep in touch with those structures, of course, with plus the community leaders and the other stakeholders. So we advise them to keep in touch with them. Fortunately, most of them, they have their telephone numbers. You know, in rural areas, that we see everyone has got a mobile phone. So they were able to keep in touch with them through the text messaging by calling them, and some who have got smartphone, they were doing the WhatsApping or on Zoom meeting. So they were keeping in touch with them. So they were not able to travel to them, but they were keeping in touch through their telephone. And for us, we assisted the partners to have specific funds for communication so that they can keep on communicating with their volunteers in rural areas and for them to communicate with us. Our volunteers, they are doing a lot of door-to-door services. Yeah? That was our plan B strategy. So for the children who are attending our kids club, for example, if they know they are coming from that household, as you know, our village settings in rural areas, they are not far apart. The houses are nearby. So they could go to house A and meet some of the children from that house, but observing all the COVID-19 measures, because we also, I forgot to mention this, we also provided them some funds to ensure they buy some of the face mask or hand sanitizer. So they were using that when they were visiting the household, I mean the volunteers. So when they get there, they were meeting some of the children with their parents, observing social distancing, wearing of masks, and they were trying to, during that visit, one of the main important things is to sensitize the household about COVID-19 and how to protect themselves or to prevent the spread of COVID-19 in their household. Because in most of these rural areas where they can't access to radios, sometimes or TV, they have a very limitation of accessing this information of COVID-19. If you look at in the rural areas, most of our beneficiaries in the rural areas, they were depending on sending their crops to be sold in cities. And also, if you look at some of our VIP members from the loans which they access from their VIP groups, they were buying, some of them, their business was buying crops from the rural areas, from other rural communities, and sending them to urban or cities to sell them. But because there was no any trucks, there was no any business between rural and urban. So they were just stuck in the rural area. They could not be able to sell anything or to send anything to cities so that it will earn some income. issue of abuse, again, you see, we have seen as a really increase in the household level, the child abuse for the children, whereby other children were involved in child labor, other children they were beaten up or punished by the parents, some with their neighbors. There's a lot of these issues which have been reported to us by the volunteers who used to visit the children in their homes. To help our beneficiaries to overcome the economic crisis where they are doing at the moment, where they are going through at the moment. So our program, like the VIP program, is very, very important at this time to help our beneficiaries to come back to their normal life. There's no any other main way we can do without helping them to overcome the economic crisis which has come as a result of the COVID-19. Of course, these other things and will follow. So to ensure there's prevent the violation of child rights, that will follow after we have strengthened their economic status. We can come and also help to prevent the violation of child rights and these other challenges which the communities are going through. They went through during this COVID-19.